Are you a Botox injector that believes all gummy smiles are the same? Well, they're not, and treating them without understanding the root cause can lead to disappointing results. Gummy smiles are common, but they're not all created equal. We can break them down into three main categories, but only two are potentially treatable with tox. Let's take a closer look. First, let's talk about a bony problem, vertical maxillary excess, or VME. This happens when there's too much vertical growth in the maxilla and surrounding dentoalveolar structures. This is what to look for: an elongated lower third of the face, lip incompetence, meaning the lips don't fully close, typically leaving about a 4 millimeter gap or more, excessive gingival display of the upper incisors even at rest, and a long face appearance, often paired with a retrusive chin. VME isn't just an aesthetic concern. It can affect function too, causing issues like difficulty closing the lips, impaired chewing, and even psychological distress from the appearance. Surgery is the gold standard for addressing VME, often combined with orthodontics. However, in some cases, tox can be used to help soften the aesthetic appearance by relaxing overactive muscles, but that won't resolve the underlying bony issues that affect function. Next, let's move to a gingival problem called altered passive eruption, or APE. This condition happens when the gums don't shrink back as they should after teeth erupt. Normally, when we grow, our gum line recedes, revealing more of the crown of the tooth. In APE, this process doesn't complete, leaving teeth looking shorter than normal. Here's how you can identify APE. The teeth are going to appear abnormally short, and you can compare them to average lengths, which are about 10 to 11 millimeters for central incisors, 8 to 9.5 millimeters for laterals, and 9 to 11 millimeters for canines. And there's often a genetic link. 65% of patients with APE have a family member who also has this condition. Unfortunately, tox isn't the solution here. The aesthetic issue isn't about overexposed gums, it's about underexposed teeth. These patients need a dental referral for gum reshaping or other procedures that will reveal more of that tooth surface. And remember, teeth can also appear short due to excessive grinding, so when in doubt, get the proper diagnosis from a dentist. Finally, we come to a muscular problem, excessive gingival display, or EGD. This is the type of gummy smile that tox is designed for. EGD is due to hyperactivity in the lip elevator muscles, causing the upper lip to pull back too far when smiling. Here's how EGD presents. The upper lip elevates 1.5 to 2 times higher than normal during a smile. This exposes more gum tissue than is typically considered aesthetic. Tox works beautifully here by relaxing the overactive muscles, reducing the upper lip's retraction, and creating a more balanced, natural-looking smile. With precise dosing and placement, you can deliver excellent results for these patients. So to bring this all together, vertical maxillary excess, or VME, is a bony issue best treated with surgery, although tox can sometimes help soften the aesthetic impact. Altered passive eruption, or APE, is a gum level problem which needs a dental referral. Tox is not the solution. Excessive gingival display, or EGD, is a muscular issue that responds really well to tox for aesthetic correction.